from your perspective, what's the biggest lesson that Iowa's business community should take away from the coronavirus pandemic when it comes to healthcare?
Sure. Lots of things come to mind, but I'll just focus on one, which is that we are, in fact, very resilient. That when it came down to it, we have a vibrant business community that's largely collaborative, and that each time the challenges were large, whether it was early on when we were trying to figure out testing, we had so many partnerships across health systems with community health departments, with large employers, whether it was about the initial therapies, whether they were happening in a hospital setting or a clinic setting or physician offices. There was so much great collaboration to now when we have a vaccine rollout. I think that package in a derecho, package in other economic considerations, this has been really, really difficult, and it has really strained the Iowa healthcare system, but the system did not break. Did we learn a lot? Did we see some weaknesses? Do we need to build some muscle strength in some areas? Absolutely. But let me tell you, the system didn't break. And the reason the system didn't break is because we've got great institutions, great healthcare workers, and great leadership across the board. I saw success in rural settings. I saw success in urban settings. I saw regions across the state working together. When one hospital was overwhelmed in a region, another hospital picked up. When we need to move vaccine doses around, we're moving vaccine doses around. I mean, there have been so many different successes, and glad to be on the panel with many of the people that have made this possible. And so I would say that the state of healthcare is, there are challenges and we have identified weaknesses, but my biggest impression is the collective strength that we do have in Iowa with our larger healthcare community.
Thank you, Suresh. And Mary, let's hear your perspective on that question, please.
Yes, well, Suresh and I share that same observation around the resiliency, both of our healthcare workers and also our institutions overall, the ability to collaborate, to solve problems creatively. I saw so much creativity whenever a problem came along. People were able to quickly pivot and to respond to that challenge in an amazing way. I think on the more side of where I have some concern, I do think we've seen much resilience, and overall, I feel our healthcare workers have been just amazing. But I think one of the worries that we all probably share somewhat from, a mental health perspective is just the cumulative stress of folks working within the healthcare system. And I think we are challenged to develop some creative ways to respond to that, so that our healthcare workers retain that resilience and continue to develop new ways of managing the stress, and to celebrate the things that have gone well, and to learn from the things that we've been challenged with. So thank you very much. And I also would like to just comment too, that I've had many years in healthcare, and all of it's been in behavioral health. And so to be as a behavioral health representative on a panel like this tells us something as well, that we are recognizing as a community that our mental health and our emotional health is foundational to success in all areas of life, and it affects all of us, and either directly or indirectly. So I'm just have to underscore that and just express my gratitude to be a participant in this important discussion.
Thank you, Mary. And Tom, turning to you, you've certainly have dealt extensively with quality issues for healthcare for many years, and so give us a little bit of your perspective on this question.
Yeah, thanks, Joe. I first of all, I want to underscore what both Suresh and Mary had said. There's been clearly demonstrated resilience, and the one thing that's unique about Iowa that I see compared to many other places across the country is we just have this collaboration, this way that we come together to solve things. And maybe it's being a rural state, I don't know. But my lesson is I believe that we had reached a bit of a stalemate. We've been trying to march toward transformation of the healthcare system for decades. And we kind of reached a point where everything was kind of static. The payers did this, the providers did this, the hospitals did this. And what happened was the pandemic, my lesson is it will never be the same. The pandemic broke many of the current paradigms. Because of the challenges we had as a healthcare system, we had to find new ways to do things. And I think it gave us permission to do some things differently. We accepted that we had to do some things differently. And I think my lesson is, and I'm actually excited about it, that I think the genie's out of the bottle. I think that we as a healthcare community now have permission to actually innovate and figure out how we construct better care that's more effective and more cost effective for our state.
Okay, thank you, Tom. And Dave, what from your physician's perspective, tell me what you're seeing.
Yeah, thanks, Joe, and great comments by all the panelists. You know, when I consider that question, the first word that came to my mind is being nimble. And that's probably something that's much more, readily available and common to the people on this line. And it isn't something that we normally associate with healthcare. But we like to pride ourselves in evidence-based medicine and taking our time and doing it right. You have a novel virus that's killing people and you have no evidence to treat it. You've got to do things differently. We put a small team of docs and nurses together, and they went with the best evidence they have. We used our data analytics. We used our patient outcomes. We changed things on the fly. We were nimble in supply chains. Suresh talked about moving PPE around the state. We certainly did that. We moved things that we never considered mobile before, like ventilators, for example, taking ventilators from one part of the state to the other. We moved people, our essential workers. We moved nurses. We moved respiratory therapists to areas of need. It's just something we've never done before. We were certainly nimble in our use of telehealth. Tom is right, that genie's out of the bottle. It's not going back. I think it's going to be great for our state. I think it's going to allow us to bring much more specialty care to your communities, which I think is terrific. We were nimble in our messaging. We were nimble in our vaccination process. It just keeps coming up again and again, Joe. So that's probably one of the biggest lessons I've learned during the pandemic.